So if you want to see it, you're going to have to come over here. Is going to be right underneath. Good save.
That's Jamie.
Wow. That is the weakness of portable tables.
Yeah. Counterstrain.
Yeah, really. So the tender point is usually right under the ankle, between the ankle and the foot, between the fibula and the foot. It tends to be under there.
That's a bladder deep sleep point.
What's that?
That's a bladder deep sleep point.
Bladder deep sleep? So putting somebody's bladder to sleep?
Yeah. Put your body to sleep.
Good night, Irene.
Good night.
So that's the point, and you're kind of going somewhere in and a little bit up under the fibula. Sore, ain't it? Yeah, not horrible. So, I mean, you're not going into the ligament here is kind of broad. And you can see where my thumbnail divot is. It's kind of where the point is, right there.
It's in a holler.
In the holler, right? And when it's sore, sometimes it's a little bit anterior.
There it is.
Okay. Yeah. Sometimes it's a little bit posterior. No. So this is a little worse anteriorly. There's a good spot. Okay. That's our lateral ankle point. Our dorsiflexion ankle point. Will you put dorsiflex your foot again? So look at that tendon that just stood up and saluted to us. This is the tendon of the anterior tibial muscle, right? See it? It's huge, right? If I just fall on the ankle space, fall just medial to it. Fall where?
Medial.
Where?
Medial.
Okay. Am I on the ankle tendon?
No.
No. Where am I?
Medial to it.
Just medial to it. Thank you. There's a little knob there, and if it's it's also tender. See where I am? Dorsiflex again, please. You can see there's the tendon, and there I am, almost behind, but it's right next to the tendon. And here's the medial malleolus. The what?
Medial malleolus.
What is that thing?
Is that a good picture?
Thank you. So it's the inside ankle bone. It's part of the tibia. So I'm just medial to the medial malleolus. Lateral, or I guess no, it's medial. Yeah, medial. To the medial malleolus. I'm medial to the tibial tendon. And there's a little point, a little hollow right there, and I'm finding the point somewhere in there.
Can you flex your foot for a second so we see where you are relative to the joint?
See it? Okay. That's the dorsiflexion point. Okay. Roll on your side, please. Roll face down, up down for a second. Here are the two big bellies of the gastrocnemius, and the extension point, here's her popliteal space, is one palm's width, one fist width, down right in the middle of the...
Is that tender?
That's the plantar flexion point.
Okay,
Plantar flexion point.
Okay, so
It's right between the two bellies.
No, it's not the popliteal space.
No. Who said it was popliteal space? I'm asking. Here, remember I said it's one fist width below the popliteal space. Here's the crease of her knee, and there's the popliteal space. And if I made a fist, it's one fist width essentially, and you can see the bellies of her gastroc. And if I follow them around, where they kind of converge is where this point is. Okay,
Beautiful, doctor.
and you can see there's a nice little divot there. A little bit red where I was. Okay.
Recording.
So they're going to lie on, in this case, it's
this
your
is the
left.
lateral ankle, right?
It's a lateral ankle.
Okay,
Lateral
So
ankle.
you're going to lie so the affected side is down. So so it's her left ankle, right? Is it right? No, it's a right ankle. Right ankle. Therefore, she's lying with her right shoulder down, lying on her right side, and her other leg is straight, kind of over it. And her foot and ankle are kind of over the edge of the table. See that? Ankle's at 90 degrees, the foot's dangling back here, right? Make a diagram in your notes. Little stick figure diagram. Good? And My fulcrum is going to go on just under the distal fibula. Where?
Distal
Distal
fibula.
fibula.
So her foot is basically hanging out in space. Right? All of these points that require putting force into the earth, I supinate my hand and forearm. I lock my elbow into my belly. I come up on my toes, and I put the heel of my hand on the place where I want to exert leverage. And then I'm going to reach under this leg to her knee and support. Okay? Eventually. But initially, I'm going to reach underneath, find my point, which is where the same spot it was. And I'm using her leg to hold the leg down, her left leg. And I'm just starting to drop my knees. I'm not pushing down with my shoulder or anything. And I'm basically creating a force that goes toward the earth. How's that feel now?
Better.
Gone?
No.
You have one finger underneath on the point?
Come around and see.
Sorry. Doing the same.
Yeah, my left hand, which I'm going to eventually move to her knee, I have underneath to monitor the point. Got to monitor the point, right?
Yeah.
So this is the way we're going to apply force when we do the anterior cruciate and the posterior cruciate.
Okay.
Supinate, lock your elbow in. Here's the heel of your hand, and apply force by dropping my one point. Now, I'm slipping off this, so I'm going to shift that. Bring that leg out just a tiny bit. There you go. If you have somebody else, they could hold the knee to help stabilize. But that should start to feel better.
Yeah.
Okay. So I'm going to come off the point. I don't need to monitor anymore. Come up, drop down, increase my force just a little bit, listening to what she'll take, right? And I might come push down with that left leg. Push down here and come back and listen. How's that feel?
Oh, no, it's back.
Actually, I was down further. There's the point.
Yeah.
How's that?
Yeah.
Okay. So there I am.
Just pressing both of them straight earthward.
Well, I'm stabilizing her knee,
Okay.
right? So it's not going earthward, it's just staying on the table. The thing that's going earthward is I'm flexing her foot laterally into her fibula. So I'm turning the foot and ankle, and I'm driving the fibula up toward her knee. And there's a place where you suddenly feel it give, and you feel breath and flow go up the... because my hand here is pretty much on the edge of that headlight at the... So here I've got the point. I'm monitoring with my hand. I'm pressing down to where... And it's really important.
other hand was
It's really important to have this leg over here, right, to stabilize. If you don't have that leg here, look what happens.
Oh.
Do I get any force?
No.
Localized? So I lost all my leverage, right?
Okay,
So
so this hand is on
the
the
leg's
top
there.
of that.
Well,
Okay.
this hand is underneath
Yeah, I
marking
got
the
you.
point.
Yeah, okay, and then...
At the point where I feel I'm going to let go, I can either go on top, but I'd rather go directly onto the
Okay,
leg.
so you were directly on the knee. Okay,
Yeah.
It
short,
hurts if you go here. Yeah, because you're.
Say it louder.
lower.
Say it louder.
Say what louder?
That
what
it
I'm doing?
hurts if she.
Oh,
If she's up there,
I would never do that because I'm pushing her knees together, and there's all. I mean, here's her
Oh.
gallbladder point, right? Yeah. So we don't want to mess with that. So I'm going to come right underneath it and stabilize that way. Now, where would we go if we wanted to make this go away?
You'd have to go.
Oh, this one that we did yesterday.
Yeah.
You go out like
Yes. It's a quiz. Okay.
There is a break.
So this point is going to resolve by flexing into the dorsum of the foot.
Ah, go
Right.
towards the point.
So now, come around the other side, Pammy.
Yes, sir.
Here's the medial malleolus. Remember that? Yep. Are you to repeat after me? Medial malleolus. Good. Here is the tendon of the anterior tibial muscle,
Okay.
right? Tibialis anticus. What is it? Tendon? So right between them and kind of in is the tender point right there. And usually when it's bad, it's really bad. That's kind of sore. It's a little bit gritty. There? Okay. And this is a point that goes away. This is really a deep ankle point. This is a point having really seems to relate to, see it in a lot of dancers, a lot of athletes. It's a point having to do with repeated ankle injury and leg injury. And it's a deep ankle point that's associated with the impingements of the ankle. And how we're going to resolve it is putting way more than a normal amount of dorsiflexion. So I'm going to start with my forearm. I'm just going to lean in until the point disappears. How's that? Yeah. Very often, I can't generate enough force like this to do it. So I will put my chest on her, monitor the point, and drop my entire body weight. Wow. And have to do about 75 pounds in order to get that to release.
Wow.
So I suggest you do it both ways. Use your forearm for the more normal, but if it's an athlete, and you know, imagine all the forces that get localized in an injury like this. Sometimes hundreds of pounds of torque get generated. So that's the dorsiflexion ankle, right?
It's just straight dorsiflexion, no
It looks
kind
like you have
of
her
Nope.
rotation or...
What?
Her foot is turned a little bit? Externally rotated a little? No?
It naturally will go.
So you're just going with
I'm just dorsiflexing the foot.
Okay.
Yeah, there's no any other. The only thing I'm consciously doing with her, even with this, I can't manage the forces. So I'll have her. Will you push your foot into me? Point your foot up to the heaven. Push, push, push. Come on. Come on, keep going. Push, 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 and then release. And then go further. Push again, please. 3, 4, 5, 6, go. Release. Good. That's dorsiflexion ankle.